Good evening. Let's talk about the medications for diabetes. Um, I'm talking primarily about type 2 diabetes here. My whole channel is basically about telling my own story, and I was diagnosed 19, almost 20 months ago as being a type 2 diabetic and was able to reduce my A1C without medication. And so most of my channel, virtually all of my channel, is about telling my own story and trying to encourage other people that there is hope if you're diagnosed as a type 2 diabetic. My channel doesn't really address type 1 diabetes, and I want to make that point because I'm not as knowledgeable about type 1. I do know that type 1 diabetics have a problem that their body doesn't produce insulin, and so they have to take insulin. My understanding is also that type 1 diabetics can reduce the amount of medication that they have to take by watching their carbohydrate, by keeping low carb, they can reduce the amount of insulin that they have to take. Type 1 diabetes is much more complicated, and type 1 diabetics will, in my understanding, will never be able to get off of insulin, but they can keep from getting to real high doses. Again, I'm not an expert on type 1. I'm not an expert on type 2, but my personal experience, my story is about type 2 diabetes. So that's an important distinction there. For those who are type 1s or who have family members who are type 1 diabetics, there's a Dr. Bernstein, and he would be a great source of information. He's on YouTube. He has books that he's written, but he has great stuff on YouTube. Dr. Bernstein, I'd type in Dr. Bernstein and type 1 diabetic if you want, and you'll probably find tons of videos from him. And he's a great source because he has lived his whole life with type 1 diabetes and has been able to keep his insulin levels real low by watching his carbohydrate count and testing himself constantly, testing his blood sugar constantly. And so if you're type 1, he would be a good one to learn from. But for type 2 diabetes, again, my story is that I never had to go on medication because I was able to get my A1C from a 9.9 all the way down to a 4.9 within about a 4-month period by strictly reducing my carbohydrate intake and by testing my blood sugar after I would eat anything. And that's very important. That's extremely important to test yourself because there's foods that people will tell you, oh, that's good for a diabetic to eat oatmeal, or that's, things like that. And then when you test yourself, you find out that's not good. So test, and you'll find out what is good for you. There's a lot of bad advice out there about what you can and can't eat. And the only way to know is to test yourself after you eat. And in a previous video, I told you how to do that to keep the costs low on that. There are sources of lower cost test strips, being the main thing that could cost you a lot. But also my story, I did a lot of intermittent fasting, also known as time-restricted eating. What I prefer to call it is time-restricted eating because so many people freak out over the term fasting, thinking you're going to starve yourself to death, and that's really not what it's about at all. But in terms of controlling the costs, time-restricted eating or intermittent fasting costs nothing. So in terms of controlling costs, that costs nothing. So in order to come off of your diabetic medication as a type 2, now I'm talking about a type 2, only type 2s have the hope of being able to come off of all medication. you must work with your doctor on that. It can be, you know, you just really have to work with your doctor on that. Now, Dr. Jason Fung, who I'm a big fan of, and who one of my very first videos was dedicated to him. You can watch that if you haven't watched it yet. Um, you know, he's the one that taught me, and he's treated thousands and thousands of patients in his clinic in Canada, uh, and been able to. A lot of his patients are on high doses of insulin. When he starts working with them, he gets them down and completely off of their insulin in most cases. And then for a while, they may only be on oral medications. And for many of them, probably most of them, he's been able to get them off of all diabetic medications. And as they're coming off of all of that, as I did, um, you know, you have to be monitoring blood pressure also, because if you start losing all that weight and improving your health, you're probably going to need to come off of your blood pressure medicine. I was never on medicine for blood sugar, but as I started losing weight from reducing my carbohydrates and doing time restricted eating or intermittent fasting, I had to come off of the blood pressure. I was on two different medications for blood pressure, and I had to come off them. I was getting lightheaded and dizzy, and tested my blood pressure and realized that my blood pressure was getting too low. So uh, you have to do, the best thing, the safest thing is to work with your doctor. And before you ever start all of this program, it'd be best to talk to your doctor and find out if they're willing to work with you on that, willing to advise you and help you come off of your medications. If they're not, it may be time to find a different doctor. I mean, I think it's that big a deal. It may be time to find a different primary care doc or a different endocrinologist. I think most endocrinologists would be happy to work with you on reducing your medication. Some primary care docs, they don't see exclusively diabetics. They see all kinds of patients, and they may not be as willing to work with. I mean, I think a good one would, but not all of them understand how you can come. They see diabetes as a chronic progressive disease that's only going to get worse and worse and require more and more medication. And so it sounds like nonsense to them when you talk to them about being able to do some nutritional things that would allow you to reduce your medications and then eventually come off of them. But so that might be an important conversation to have with your doctor before you ever try to start a process like that. And if that doctor is not willing to do it, try to find another primary care physician who is willing to work with you on that. And you might have to network with other diabetics and talk to them about who they see, and see if they have a doctor that's willing to work with people on things like that. I think it can be very helpful to network with other diabetics and try to meet some diabetics who've done what I did. And if you were in the Dallas area, I would send you to the same doctor that I saw, and because he would be excited to work with you on reducing your medications. But if you're, I know my viewers, I've been looking at the YouTube analytics and see that I've got subscribers in England and in Finland and Australia and India, and one from Egypt. And so finding a doctor that you can work with there, I don't know what that process would look like, but I think it's important to work with your physician as you attempt to reduce your medications at first and then perhaps come off your medications for diabetes, for type 2 diabetes now we're talking about. And then you probably, if you're on other medications, which many diabetics are, they're usually on blood pressure medicines because of their weight and the whole metabolic syndrome and everything. And so you're probably going to need to taper off of those as well. So it's definitely important to work with a good doctor on all this. So that's my advice, is to Have the discussion, number one, with your doctor before you start a program like I did. And it can happen. And uh, thousands of people have done it already before you. Uh, but if your doctor is not willing to work with you, you might need to find a different doctor. That's just my opinion. That's not medical advice. That's my opinion. And that's what I would do. If I had a doctor that did not want to work with me on uh, dietary type solutions to diabetes or uh, that sort of thing, I would find another doctor. There's plenty of doctors around. I'd find another one. So I'll finish up by saying live healthy, finish strong. Thank you.